Good afternoon, everyone. This is the Shared Learning Collaborative informational webinar. We are very excited about the application that we shared with the field this month and hope that you will apply for what we hope will be a really great experience for select teams working to advance reproductive well-being in their communities. And so we wanted to host this brief webinar to provide background on reproductive well-being, how we got here, and hopefully answer any questions that you might have as you fill out the application. So my name is Claudia Nunez Eddy. I use she, her pronouns, and I'm the program manager here at Power to Decide.
And my name is Kelsey Williams. I use she, her pronouns, and I'm the program coordinator here at Power to Decide.
So Power to Decide is a private, nonpartisan, nonprofit organization whose mission is to advance sexual and reproductive well-being for all by providing trusted information, expanding access to quality services, and catalyzing culture change. So over the next 15 minutes, we want to provide you with some background on the reproductive well-being movement work that we've been undertaking, with the hopes that this background and context will be helpful to you as you start thinking about whether you want to be part of this work with us and if there's alignment with what is already happening, both in your own work and in your community. And so we wanted to give a brief overview of the application process, as well as to answer and direct you to some frequently asked questions. So first, we just briefly want to share a little bit on the history and development of reproductive well-being. So in 2017, Power to Decide convened over 40 organizations that spanned the spectrum of disciplines from public health, medicine, repro health, repro justice, academia, faith groups, government entities, social services, and more to really understand the gap between pregnancy intention and contraceptive behavior. And so at that first meeting with this group, it was made clear to us that as we talked about intentionality and behavior, that intentionality was really a loaded word, and was not the framing that we needed or wanted when talking about the challenges that folks face when accessing sexual and reproductive health care and when thinking about their own health and well-being. And so in 2018, we worked with that steering committee, as well as an expert work group, to really interrogate some of the existing assumptions in order to do this work and to do this work well. So for example, the assumption that everyone has choice or autonomy. And so we found during our conversations with folks that many people feel like they don't have choice or autonomy to make decisions around their sexual and reproductive health, and that not everyone has the same amount of decision-making power. And so with input from the steering committee and expert panel, we came up with the term reproductive well-being. And so we then did focus groups with over 300 individuals. So folks that were influencers in social services, medical professionals and providers, as well as pregnant and parenting teens, and more, to pressure test this term reproductive well-being and to really understand the barriers that folks faced when, trying to achieve reproductive well-being, and how really understand how individuals wanted to experience reproductive well-being. And so we found that the term reproductive well-being seemed to really resonate with folks. And slowly that definition of reproductive well-being really started to take shape. And I'll share that on the next slide. But in 2020, Power to Decide launched the first reproductive well-being shared learning collaborative to implement reproductive well-being in communities across the US. And so over a 3-year funding period, Power to Decide convened 8 place-based teams with cross-sectoral representation to really build systems of support in communities. And so in 2020, we continued to promote and expand our reproductive well-being work. And now in 2023, we're really excited to announce the application for our second cohort of reproductive well-being shared learning collaborative place-based teams. So on this slide here, you'll see the definition of reproductive well-being that came out of our work with the steering committee, with the expert work group, and with focus groups with over 300 individuals. And so we heard from all of these individuals and groups that reproductive well-being really means that all people have access to the information, services, and support that they need to have control over their bodies and to make their own decisions related to sexuality and reproduction throughout their lives. So in addition to the definition, during these focus groups, people spoke to what they saw as the tenets or pillars of reproductive well-being. And so you'll see here the pillars of reproductive well-being that really strongly came out of these focus groups. So people wanted to be seen and understood. They wanted to be trusted by their provider and really met where they are. They wanted their experiences, their cultures, and desires to be respected. They also wanted autonomy. They wanted the freedom and safety to experience sexuality on their own terms, as long as it was consensual and didn't harm others. Folks also wanted to receive access to information available to them so that they could make their own informed decisions. And lastly, they wanted to be surrounded by systems of support. And they really wanted reproductive well-being to be an essential component of overall health. So not just, in the healthcare system, but really embraced by society as a whole. And so again, based on what we heard from folks related to the definition and to the pillars of reproductive well-being, we know that the core values center on equity, autonomy, and agency, and that reproductive well-being is holistic. And that's what we heard from folks in terms of why reproductive well-being resonated, really because it goes beyond isolated healthcare services and encompasses physical, mental, and emotional health, and embraces that robust system of support. And reproductive well-being is also a strength-based approach that positions healthy sexuality and reproductive freedom as integral parts of health and well-being, and something that's discussed and embraced by all. So the other thing we knew was that while the community is undoubtedly best positioned to determine the specific approach to reproductive well-being in the place that they live, there was an opportunity to share best practices and evidence-informed approaches based on other places working with similar goals. And so we brought together an expert panel of people who were working on the ground, doing this work in their communities, who could tell us and inform us on developing a community framework for how this work could be undertaken in communities. And so we created a place-based framework that includes 4 action areas: health equity, policy, education and communication, and healthcare and service delivery, with strategies that communities can use as they work to advance reproductive well-being in their community. And again, this framework is really meant to be tailored depending on the place or the community, because we know that strategies that work in one community might not work in another, and that ultimately community members know what approaches will work best in the place that they live. Okay, so how is reproductive well-being and the reproductive well-being framework implemented? So in 2020, Power to Decide launched the first reproductive well-being shared learning collaborative to support 8 place-based teams as they work to improve reproductive well-being in their place, and really just created a space for teams to share with one another their learnings, their findings, and best practices. And so if you're curious, you can learn more about the first cohort of teams on our website at powertodecide.org/reproductive well-being. And we're really excited to announce the application process for our second cohort of place-based teams.
So now we'd like to share a little bit more about the second cohort of the Shared Learning Collaborative that Power to Decide is planning to convene at the beginning of this year. So here you can see that Power to Decide is convening a 3-year shared learning collaborative of up to 10 place-based teams with cross-sectoral and youth representation. So this means that 3 core team members should come from different sectors, which might include healthcare, social services, juvenile justice, housing, public health, etc. And so the 4th team member will be a young person aged 18 to 25. And selected teams will be committed to building systems of support for reproductive well-being in their regions or communities. And each team will be able to define what that place means to them, which could be a city or a county, a region, or a state, depending on the context. As part of the Shared Learning Collaborative project, Power to Decide will provide successful teams with up to $20,000 dispersed in years 2 and 3 to support efforts to advance reproductive well-being in their place. Power to Decide will also provide a $3,000 stipend dispersed in $1,000 increments over the course of the 3-year grant period to the youth ambassadors serving on the core team. Separate from this funding, we will provide support to teams to travel to 5 in-person gatherings during the grant period. There will be 1 meeting in year 1, 2 meetings in year 2, and 2 meetings in year 3. Power to Decide will also provide opportunities to learn and share best practices between participating teams through an interactive online support platform. And lastly, Power to Decide will provide each collaborative learning team with a coach who will offer ongoing and customized support. So each team selected to participate in the Shared Learning Collaborative will have 4 core team members, 3 team members who come from different professional sectors, and a 4th team member who is a young person. Each team will lead a reproductive well-being initiative in their place throughout the 3-year funding period. Each team will attend 5 in-person convenings, and each team will also participate in monthly virtual check-ins with Power to Decide, complete an annual reproductive well-being online assessment, which will be provided by Power to Decide, and each team will submit quarterly progress reports. And as for the youth ambassadors who serve as the 4th member of the core team, they should be between the ages of 18 and 25, be in good academic standing if they are attending school, though youth of all backgrounds are eligible to be a member of the core team, and this young person does not need to be enrolled in a college or have a college degree. The youth ambassador is also expected to attend 5 in-person convenings and serve as an active member of the core team, including joining the monthly virtual team check-ins and supporting the reproductive well-being initiative in their place. So as a result of this shared learning collaborative, we anticipate that each team will lead a collective impact initiative to advance reproductive well-being in their community using a portfolio of evidence-informed interventions that support reproductive well-being in their place. We also hope that teams in the Shared Learning Collaborative will share their learnings, stories, and innovations with other teams in the Shared Learning Collaborative and with the broader field in order to foster innovation within each team and across teams participating in the Shared Learning Collaborative. So successful teams selected to participate in the Shared Learning Collaborative will, of course, receive up to $20,000 over the 3-year funding period, which will support reproductive well-being in their community. The youth ambassador serving as the 4th core team member will separately receive a $3,000 stipend for their work on the project. And just as a reminder, Power to Decide will cover travel costs for the 4 core team members to attend the 5 in-person convenings.
Okay, so now we'll share a little bit more about who can apply and what the application process will look like for the Shared Learning Collaborative. So nonprofits and non-governmental agencies are welcome to apply, as well as higher education institutions like universities or community colleges, and government agencies like local health departments. So we're looking for teams of 4 members representing multiple sectors, like Kelsey mentioned. And this is just what we have found to work best in a team approach to this reproductive well-being work. Each team is expected to go back into their communities and work with a larger stakeholder or coalition group in their place. But it is that core team of 4 that will be working directly with Power to Decide on these pieces. So teams must also be engaged in an existing cross-sectoral coalition or initiative that supports sexual and reproductive health within their place, just because that is such a key element of this work that we'll be doing together. So it's helpful that teams already have these existing coalitions in place. We also, again, are just emphasizing that cross-sectoral representation is incredibly important in this approach to reproductive well-being. And so we've offered here some examples of some of the sectors that may be represented in your group of 4, but of course not every single one of these needs to be represented here. But for example, you might have one core team member from economic development, one from reproductive justice, and one from education. And then, as of course, the 4th core team member is the young person as well. So here on this slide is information on how to apply for the Shared Learning Collaborative opportunity. And all of this is, of course, laid out in the application form, which you'll see a URL listed here on this slide. So included in the application form is a contact information for each of the 4 core team members, a letter signed by the executive leadership from each organization represented on the core team. And just want to clarify here that teams do not need to submit an organizational letter for the youth ambassador. So that is just for the 3 professional core team members. A completed community readiness assessment, and you'll see on the application a link to one example of a readiness assessment that teams can use, but teams are welcome to select a different community readiness assessment if they'd like. And we're asking this just so that teams and communities have a strong sense of where they're at when they enter this work. And then lastly, there are 2 narratives that need to be submitted, one for the core team as a whole and one for the youth member on the core team. And we did just want to offer 2 different methods for submitting the narratives because it's really important to us that we aren't just selecting organizations that have really strong grant writers, but that we're selecting groups that bring the skills, capacity, and readiness to be successful over the 3-year grant period. And so teams can submit the narrative either in writing or in a video format that maybe showcases your community or place. And so again, on this slide, you'll see the link to the full application. And you can also find a PDF version of the application with all of the questions required in the narrative on our website. So the timeline for the application process is shown here. We'll be accepting applications through the Microsoft form until April 28th. In May, selected teams will be extended an invitation to join a brief interview with a Power to Decide team member. And by June 9th, teams will be selected to join the Shared Learning Collaborative. And then there will be a virtual kickoff meeting in mid-June, followed by the first in-person convening in September 2023.
So to learn more about the program and view frequently asked questions, please feel free to visit the website that we have listed here on this slide. You can go to powertodecide.org/reproductive-well-being. And then as a reminder, applications to join the 2nd cohort of the Reproductive Wellbeing Shared Learning Collaborative are due by April 28th. Teams can access the application using the Microsoft Forms link shown here on this slide. Teams can also learn more about the Reproductive Wellbeing and Shared Learning Collaborative opportunity on our website at powertodecide.org/reproductive-well-being. And you can feel free to contact us at rwb@powertodecide.org if you have any additional questions. Please don't hesitate to reach out. We appreciate you all for joining us on this informational webinar and look forward to reviewing applications and hope that you consider applying, joining us in this exciting and important work. Thanks so much.